Perfect. All right. Good morning. Thank you for coming in today. Can you start telling me a little bit about yourself and what inspired you to be a nurse practitioner?
Um, well, my name's Taylor Wellborn, and I think my whole goal for wanting to become a nurse practitioner, specifically a women's health nurse practitioner, is the fact that the community needs more education, and I want to be able to make that difference for the community and educate and help them with their preventative care and the more sensitive and fragile times of their life.
Very nice. And why would you be interested in working in our primary care practice?
Um, I'm super interested in working in your primary care practice because of the values and beliefs that you guys have associated with your company and how you truly advocate for your patients.
Very good. And would you be able to describe a difficult situation that you encountered as a registered nurse and how you handled it?
Absolutely. So I currently work in a postpartum unit, or I did as a registered nurse, and very often we would encounter failed home birth patients, and that can usually create a pretty intense environment for the patients because they are mourning the loss of their birth plan and their loss of control. And I just so happened to have gotten a patient that was a transfer of care, and she just wanted absolutely nothing to do with us. And it made it very difficult for me to do my job of being able to take care of her and take care of her baby. And I think by the end of the night, just giving her some control back and letting her make the decisions that she essentially lost when she was a transfer of care for the safety of her baby kind of really helped to pave that recovery and trust in us that we aren't there to hurt her.
Excellent. And as a new nurse practitioner, what do you think will be your greatest strength?
Um, One of my greatest strengths, I think, would be my patient education, being able to break down whatever issues my patients are having and be able to explain it to them so that they are more receptive to taking on the regimen or whatever treatment plan that we have for them.
Excellent. And do you have any questions for us?
Um, what, how do you guys encourage that building of trust with your patients when you accept new ones?
So, accepting when we are accepting new patients, we try to tell them, what our practice is about. Try to build rapport with the patient, and we try to support our staff members as well, so they feel supported and they can provide the best care to the patients.
Okay, perfect. Yeah, I think that would conclude all my questions.
Thank you.
Okay, and then we'll switch roles. Okay. Hi, good morning. Um, how are we doing today?
Good morning. We're doing good. We're having a good morning this morning.
Good. A couple questions for you for this interview.
Mhm.
Um, can you tell me how you as an NP will fit into our practice?
Yes, I've been working in acute care for a little while now, and I believe that I developed the, experience to build rapport with the patients and really try to listen and understand what their concerns are, and not only diagnose and treat, but support in whatever else difficulties they might be encountering in their life.
Okay, great. How would you work with your coworkers or other healthcare professionals to provide your best patient care?
Teamwork is always important. I feel that we never we can never work by ourselves. We need to support each other, and communication. It's always important. In collaboration as well.
Mhm.
So try to support them in whatever they need. Provide resources and answer questions whenever they need some help, and do the same. Ask questions, if there's anything that I'm unfamiliar with, to make sure that I do ask questions and ask for help.
Okay, perfect. How would you handle a situation where you're unsure of the diagnosis or the treatment plan?
I would I would probably try to discuss with another provider because I wouldn't want to harm my patient, and try to dismiss something or even miss something that I thought was important, or get home at the end of the day and be thinking that I missed something.
Mm-hmm.
So before I let that patient go, I would probably confirm with another coworker, another provider, do you think that this is appropriate? Do you think that this is probably correct? I would ask for some input and feedback.
Perfect. And then last question for you. When have you ever encountered a disagreement with a coworker and how did you handle that?
Not everybody thinks the same. We're not perfect, and we will have disagreements, unfortunately, throughout life. But it's important to try to view the situation through somebody else's perspective.
Mm-hmm.
And, even if I don't agree, at least listen to them and see how can we meet in the middle. How can we agree on just something that's going to be beneficial for both sides?
Okay, perfect. And then do you have any questions for me?
Yes. Do you guys have any formal mentorship orientation program for new grads?
Yes. So we start with a minimum of or not 6 months, 6 weeks of just kind of shadowing and learning the ropes before releasing you on your own. And then before that 6 weeks is up, we do kind of a check-in just to make sure that you are adjusting well and making sure that you feel prepared to step into your new role.
Excellent. Okay, thank you very much.
Thank you.